Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 40 of the Lengthening Live, where the patients get to interview the guests. And today we have a nostalgic surgeon coming back to the show. We have Dr. Shahab Mahboubian. Dr. M, how are you?
Good. Nice to see you again, Victor, as always.
Absolutely, absolutely. And I got to say a fun fact here for everybody who doesn't know. Dr. M was the first surgeon that I interviewed on my channel. And it's big kudos to him, because if it wasn't for him, I wouldn't be able to leverage his interview to get other surgeon interviews. So you got to thank this man for saying, hey, what the heck? Let me just do it. I don't know this kid with 200 subscribers, but I'll do it anyway. And now we're well over 11,000. So thank you. Appreciate that.
Nice.
All right. So the way that the show works, and I apologize in advance to people, we had to do this 30 minutes early, so you guys can kind of kick into the show, but you can watch it later. The way that this works, we're going to do the submitted questions first from the patients, and then anybody in the chat, we're going to answer those second. So, all right. Hey, we have Randy in the chat. Okay. So, Dr. M, the first question that I had that was submitted was about hyperextended knees. So the patient was asking, do you know if it would still be possible for someone to get limb lengthening done if they have hyperextension in their knees, if they're going for femurs of 3 inches? Would they still fall in line with the safety, or would they be at more risk when they have this condition?
So for those of you that don't know, hyperextension is when your knee, let's say, normally bends like this, but if you get hyperextension, it bends back a little bit. So some people have lax knees, and they have a tendency for their knees to bend backwards a little bit. It does put them at increased risk of different types of injuries, including ruptures of your ACL, hamstrings, PCL. So it becomes a sensitive part of the body, especially with sports. As far as whether or not it's safe to do a limb lengthening procedure, I have actually had a couple of patients that had hyperextension in their knees, but they weren't that bad. And in fact, after they get their lengthening, their hyperextension becomes less because again, you got to understand the hyperextension is due to laxity. Mm-hmm. So, and when you lengthen, you're lengthening and everything kind of gets tighter. So they actually improved their extensibility. Wow. So yeah, it is still possible to do the surgery, but it really depends on the degree of laxity that you have.
Right. And obviously that would be something you would check out in the initial consultation when they see you. Very cool. Right. All right. The next question here is about surgery protocol. So this person was asking about x-rays. So they said, we don't talk too much about x-rays. I'd like to know how many x-rays are done from the beginning till the end of the entire limb lengthening process. We know that the x-rays increase the risk of cancer, DNA damage. Do you know if this subject has been covered, and what do you think about it?
It's a very good question. I've never been asked that question before about, how much x-ray you get throughout the process. There is quite an extensive amount of x-ray. However, with the new technologies that are out there, with everything being digital, the amount of x-rays that we use is very minimal. Mm-hmm. So you only need very few, small amounts of x-ray for us to be able to read the bone and see how your bone is growing. Right. But yeah, you need x-rays at the beginning. You need x-rays every 2 to 3 weeks while you're lengthening, to make sure that the bone is coming in correctly and not growing too much bone and not growing too little bone. And then, after you're done lengthening, you get x-rays maybe every 3 months until it's time to take out the nails, and then that's it. So the total amount of radiation, I really don't have an answer for that. Yeah. But again, overall, it's still going to be fairly minimal because of the new technologies that we use with digital x-rays.
Right. Yep. Everything's advancing. All right. So the next question is about anesthesia. So this person was asking about the difference between general anesthesia and the spinal one. I guess that's the epidural. Can you confirm that intubation is not used? So I guess they're just saying, do you offer the difference between the two to your patients, or which one do you prefer to use?
I prefer to use general anesthesia. One of the problems with spinal anesthesia is that if there's something wrong after surgery, we don't really know because, everything below the waist is numb.
Right.
So that's a spinal that's a spinal anesthesia, is when they give you an epidural into the back, kind of like what they do for women when they give during childbirth. So basically what it does is numb the waist down into the legs.
Okay.
So, one of the things that we always worry about after limb lengthening procedure is compartment syndrome. Mm-hmm. And if the patient is bleeding too much into their soft tissue, that's compartment syndrome. They wouldn't know it. So that's why it's important to kind of just do under general anesthesia, so we could understand what's going on afterwards. We don't want to take that risk.
Gotcha. Okay. Yeah. The next question is about getting a surgery before limb lengthening. So the person was saying, I need a nose surgery due to a minor motor accident I had a few years ago. Visually, my nose looks fine, but there's some cartilage damage. I probably need a small graft. It's done under general anesthesia. I plan to do it 1 year before limb lengthening. My question is, do you have information about how the body heals and competes for healing ability in other areas? So she's saying, when your body is still recovering at one place, is it better to wait till it's fully healed before having another surgery so that you don't take away from the healing ability of your bones for the leg lengthening?
I wouldn't worry so much, especially with a small part of the body, which is the nose. It doesn't take up all of your healing abilities. Think of it this way: if you cut your arm in multiple places, let's say you fall off your bike or something, and you get bruised up and abrasions throughout your body. It's not like one part heals and then the next part heals, and then so everything heals at the same time. So it really doesn't take away from your healing ability. And that's actually one of the reasons why we are able to do a staged procedure for when we do quad lengthening. So, when we do the tibias and the femurs, we could lengthen all 4 segments at the same time without worrying that, one segment is getting too much attention from your body. So I wouldn't worry about that. As far as getting anesthesia, I would recommend, waiting at least a month prior to undergoing any other procedures from one surgery to another.
Gotcha. Okay. So the next question is about lengthening devices. So this person was asking about, they're trying to decide whether or not to use an external fixator like the lengthening over nail method or the Precice 2 for their tibia. What are the pros and cons of each, and what do you suggest?
With the invention of the Precice nail, which is all internal, everything has become so much easier, less painful, and more predictable, much better results and outcomes compared to the external frames that we used to use.
Right.
So we've, in my practice, we've done away with external frames altogether because it's just so much easier for the patient and such better results to do everything internal. The lengthening over a nail is kind of an older technique. Some people think, oh, well, that might be the cheaper way to do it. And it may be cheaper if you do it in other countries, but in the US, it's actually going to cost you more because there's multiple surgeries you got to do for that. You got to put the frame on, lengthen it out, then you got to take the frame off, put the screws in. It's just multiple surgeries, which can cost even more money.
Right.
But in my practice, we just use the Precice nail to do the lengthening, which I think everyone's been pretty tolerable with it, and it's had great outcomes.
Yeah, and I think it keeps the rate of skin infection really, really low as well.
Yeah,
definitely keeps it low. All right. This next question is still under the lengthening devices. He's saying, I'm now age 40. If I go with the Precice 2, how long can I stand and walk if I lengthen 6 centimeters? Is younger better for faster bone consolidation? So there's kind of 2 parts to that question.
Younger is better for faster consolidation, but you don't need to necessarily worry so much about consolidation of your bones. The most common problem I have with my patients is that they grow too much bone. So I actually always have to tell them, okay, well, we got to speed up the process. We got to speed up the lengthening so you don't get premature consolidation.
Yeah.
So it's never been an issue. The problem is that the soft tissues can't handle a very fast lengthening. Everything becomes tight. Your joints become tight and painful. the muscles start spazzing up. So, it's good when you're lengthening at about 1 millimeter a day. You don't need to lengthen any faster than that unless you have to.
Gotcha.
Sorry, what was the other part of the question?
The other question was basically, if he gets the Precice 2 nail, how long can he stand and walk?
Right. So with the Precice 2 nail, it's still a very strong nail. It's made of titanium. It can support up to 75 pounds on each side. If you get the thicker one, maybe a little bit more, but we recommend not more than 75 pounds on each side. So you are able to walk right away, right after surgery. And in fact, we actually get our patients up and walking the same day as surgery, just to help with circulation. We don't make them walk too far, but at least get up, stand up, because it's really important for the circulation and to get that bone healing potential going. But as long as you're using a walker and putting most of your weight on the walker, there should be no reason why you shouldn't be able to walk. Now, if you need to walk long distances, I recommend you get a wheelchair, because it can get a little bit tiring to walk very long distances using a walker.
Yeah, for sure. That's a lot of upper body work there. All right. The next question is about physical therapy, and then there's an assessment with an x-ray. So this person was asking, my question is, if someone's considering cosmetic limb lengthening and really wants a place with physical therapy, does Dr. M have a physical therapy program or any recommendations of physical therapists in the area where he's located that he can refer a patient to?
Yeah, actually, I have a couple of physical therapists that will come to your house or to your hotel, wherever you're staying. They're really great. Once you feel that you're kind of more mobile and you want to stop having someone come to your house or to your place to do the physical therapy, then there's other locations near my office where I could send my patients to that could do their physical therapy. Now, a lot of patients, they're out of town, so they want to come in, get their surgery, go home, which I completely understand, and I actually encourage it, because when you're in a friendly and familiar environment, you tend to do a lot better with your recovery. But in my physical therapy instructions, I always write out exactly what needs to be done, what they need to work on, the weight bearing status, all that stuff goes on to the prescription. And all the physical therapists have to do is follow my instructions. And it's fairly straightforward. You don't have to go to a specialized physical therapy after this type of surgery.
Okay, gotcha. All right. There is a question with a patient who sent in an x-ray with markings of their nail. I don't know. Do you want to do a live assessment of an x-ray from another clinic, or do you not want to do that on live air? They're just trying to get like a qualified surgeon. They don't feel like their surgeon did a good job, and they want to see. It's up to you.
Yeah. I'm a little worried about doing things like that.
Yeah. I hear you. Okay, I'll ask you
advice. If they want my advice, I would do it personally, not
through email. Just email you.
Sure. Yeah.
Okay, I'll tell them that. But they do have a question, and their question was, what's the reason for one leg healing slower than another, and what are some supposed treatment options thereafter? For example, this patient had poor regenerant on both the left and right legs, but then they got PRP injections to help heal, but it only healed on one side where it was injected. What type of treatment modalities would you implement to help the other side heal for bone healing? I guess that's what they're asking.
It's a good question. It's actually a great question. The two sides, let's take femurs, for example. When you're lengthening the two femurs together, they never lengthen the same.
Okay.
There's always a little bit of discrepancy as far as how much this one grows versus the other one, how they fill in. I've had patients where one side is like making too much bone and the other side is making too little bone. And this is why we take x-rays regularly to adjust the lengthening rate. Now, with the particular bone, you have the inside of the bone and you have the outside of the bone. We call them medial and lateral side. Sometimes you get excess bone formation on the lateral side, and sometimes you get it more on the medial side. So again, it's never perfectly congruent where you get like, equal growth on both sides. It's just the way the body heals. Uh, but if there is missing bone, yeah, you could do PRP or stem cell injections, but you got to just make sure that you inject it into the area that's missing bone. So
Gotcha.
that's
Okay.
all I can say. I mean, if it still didn't grow on the middle, like the medial side, that's the side that you got to inject.
I see. Interesting. So it's a very local injection they should be doing.
Yeah,
Okay.
and it does
Very
help.
cool.
Stem cells, they do help
They do.
stimulate the bone growth.
Gotcha. Have you done that at all? Do you do that for some of your patients or not? Not usually.
I've done it a few times. Not anything recently. I think
Hmm.
the way I've changed around my techniques uh, to make everything very concentric, and the cutting of the bone has to be very exact, and
Hmm.
it's done very delicately. So I've changed my technique around throughout the years to make sure that everything's done the same and everything's done perfectly, so that we do get good quality bone growth.
Right.
Um, Again, as I said, most of my patients, the biggest problem they have is that they make too much bone. So we have to speed up the lengthening process so that they don't get premature consolidation.
That makes sense. Absolutely. I actually had a question about something myself. I'm a bodybuilder. I train heavy, and I had a discrepancy for a long time. I think one of my meniscus on my left side is getting a little bit of wear and tear, so I think I may need a meniscectomy. How long does it take to recover after a meniscectomy and maybe like partial debridement of the articular surface of the knee joint? Like, what do you see in some of your patients with that type of thing? A couple of
I've
weeks?
done thousands of meniscal surgeries.
Okay.
The ones that I've had to repair, those take a little bit longer time because it's a repair. But
Okay.
most of the meniscal surgeries are what you said is a menisectomy, which means that we shave away the part that's torn.
Hmm.
And usually these are small tears, and we just smooth out the tear so that it doesn't catch and it doesn't cause pain.
Right.
Uh, it doesn't cause too much problems in the long term unless you take away too much of the meniscus.
Mm.
Uh, but because it's a fairly simple procedure, and it has a quick recovery because it's done arthroscopically, usually you're back to running or maybe even jogging within 6 to 8 weeks,
Okay.
and usually back to full exercises within 3 months.
Nice. Okay, that's optimism. I'll take that. Thanks so much, Dr. M. Okay, so now we're going to go into the live chat because there's some people asking questions there. I don't suspect it to be taking too long, but let's go ahead right to number one here, and you'll actually see the question on the screen because they're live. So Dr. One is asking, I did femurs about 2 years ago, still having residual pain at the quadriceps tendon, superior aspect of the patella. Did I not stretch enough? Also, how many tibia fibula cases do you do versus femur cases, femoral cases?
So yeah, as you stretch your femurs, all the tendons get stretched out also. So it's not uncommon to have pain at the top of your patella because that's where your quad tendon attaches to. And there's a tendon that attaches from the muscle to the bone. So that could get inflamed and it could stay inflamed for a very long time. There are different things that you could do, such as stretching. You could do cortisone injections. You could also do PRP injections. All these things do help reduce the inflammation that's still residual there. Tendonitis is very difficult to treat, especially as you get older. Your body doesn't recover as quickly. So you need these different types of modalities, cortisone injections, PRP injections. Some people even use CBD creams because that's also an anti-inflammatory. And all these, in combination do help, but it takes time. You have to really rest the muscle and the tendon in order to, let the body heal this tendonitis.
Gotcha.
I've dealt with tendonitis before as well. It takes forever for it to go away.
I've had it too. Yeah, it does.
You gotta just let it rest.
Mm-hmm. Yep.
As far as how many tib fib cases I do versus femurs, I most commonly do femurs because I think femurs are a lot easier to handle for patients. They're less complication, faster recovery. It's cheaper, and it's not as much pain, and you're also able to usually gain the full 8 centimeters versus tibias. Tibias, it's a much more refined technique, lengthening. You got to put everything perfectly. Otherwise, you could get deformities as you lengthen. You could get different kinds of complications. So I think I try to encourage my patients, if they're going to do one versus the other, I try to encourage them to just do the femurs.
Do the femurs, yeah. That's what everybody kind of leans towards, is femurs. Okay, next question here from Benjamin Mendoza. He's asking, is it possible to do 4 centimeters on both the femur and the tibia in the first set, then come back and do another 4 centimeters in the femur and tibia on the second time around?
That is possible. I don't know why you would want to do that. I think if you're going to do so basically they want to maximize the amount of lengthening. And I know some doctors, if you're going to do a staged procedure where you're doing tibias and femurs together, that you don't lengthen more than 5 centimeters on either side, because the soft tissues can only take so much. But if you're really looking to maximize your height with 2 separate surgeries, femurs and tibias, I would recommend doing one, either the femur or the tibias. Do one or the other segment, lengthen it out as much as your body can tolerate, and then give yourself a good year to fully recover from that surgery before doing it again. So rather than doing both at the same time twice, I mean, that's just a lot of surgery, and it's unnecessary. Right. So if you really want to maximize everything, I would do one segment at a time, lengthen it out as much as your body can handle, and then work on the recovery before doing the other one.
That's very cool.
With that said, again, I would still recommend doing the femurs first and then tibias later, because tibias are more difficult to recover from. But once you've done the femurs, it's like you become an expert. So
yeah, there's been some patients that everything about the walker and how to move around.
Yeah, it makes a huge difference.
Yeah, for sure. All right. Next question here from Reaper 123-100. What do you believe is the next biggest limiting factor in limb lengthening? And what do you predict the procedure to look like over the next 10 years? What is the next great step or technology in limb lengthening?
It's a good question. When I was in residency and I was learning about this whole limb lengthening procedure and what it entails, I thought to myself, instead of using these crazy frames or these old internal nails that you had to click, to make it longer, and I was like, in my opinion, the best way to do this is through a magnet. Yeah. And sure enough, like a couple of years, into my practice, they came out with a Precice nail, which is magnetic. Wow. I don't see this technique getting any easier or improving any more, other than making the weight-bearing nails. That's probably the next step, which I know Precice NuVasive is working on. And hopefully they come out with the new weight-bearing nail sometime in 2023. And it's not going to be called STRYDE. It's going to be called something else. We don't know yet. But they are working on it. We don't know if it's going to come out in 2023 or 2024, but they're working on it. But that's going to be the next step.
Nice. Okay. So back to the weight-bearing nails. And I heard a little rumor about that as well. And that's all I know, is that they're working on it. So we'll have to wait and see. The mystery continues. All right. Next question here from Jay New. He's asking, Dr. M, is removing the Precice nail after lengthening for a weight-bearing trauma nail worth the additional surgery?
Is removing the Precice nail after lengthening for a weight-bearing trauma nail?
So swapping it. There's a surgeon that does this. They call it the accelerated weight bearing program, to kind of help patients who want to get back to a walking, gait sooner. Yeah.
Gotcha.
Yeah.
No, I would 100% disagree with that. Again, the less surgeries, the better, in my opinion. And it's really not necessary. I mean, if you wait an additional month, your bone should, or maybe 2 months, your bone should be strong enough to be able to handle your full weight. Once you're done lengthening, whether it's 4 centimeters or 8 centimeters, it usually takes anywhere from a month to 2 months for your regenerate bone to grow back together and be strong enough to be able to support your weight. So I don't think it's worth the additional costs, risk of surgery, risk of infections to undergo an additional unnecessary surgery, in my opinion.
Okay. That's his opinion. We got it, guys. All right. So the next question is from Devin May. How does Dr. Mahboubian feel about patients who would already be considered tall getting this procedure done to be even taller, like someone who is 6 foot trying to get to 6'5"? Do you have a height limit?
I don't have a height limit, but again, I do talk to my patients, and I always ask my patients, why do you want to do this surgery? You know, this is not a simple surgery to go through. Mm-hmm. It's painful, it's expensive, there's risks. There's risk of complications. So I always make sure my patients are doing it for the right reasons. Mm-hmm. Now let's compare someone that's 5'3" and they gain 3 inches and they become 5'6", mm-hmm. versus someone who is 6 feet tall and they become 6'3". Mm-hmm. The percentage of difference from 5'3" to 5'6" versus 6 foot to 6'3" is a huge difference. Yeah. So the person that's going from 5'3" to 5'6" has a huge increase in the percentage of their height, versus someone that's doing it from 6 feet to 6'3".
Right.
The people that are already tall, I don't think they gained the advantage or the satisfaction mm-hmm. that someone much shorter than them would by gaining the 3 inches.
Right.
So yes, I get plenty of patients that, well, not only do they email me, but they also come into my office and consult with me who are 6 feet and above, and I try to discourage them from undergoing the surgery because I honestly don't think that they're going to gain that much advantage from the percentage of the height increase that they get.
Gotcha. That makes sense. Yeah. It was designed for people for short stature. That's kind of what it's for. His follow-up question is, what is the tallest height someone has achieved limb lengthening by Dr. Mahboubian?
6 inches.
6 inches.
6 inches. And that was somebody that, again, that person did their tibias first.
Interesting.
Lengthened it out 8 centimeters. It took them a long time to mm-hmm. be able to walk normally, but once he was able to walk normal, he decided to do his femurs afterwards, and he gained another 8 centimeters for that. So he gained a total of 16 centimeters, which was 6 inches in total. And that guy went from 5'2" or 5'3" mm-hmm. to 5'8".
9. Yeah,
5'9".
5'9". Yeah.
Like
that's incredible. And
that was like but it's rare to be able to gain the full length from each segment, because you have to understand you're not just lengthening the bone, you're lengthening all the soft tissues around the bone as well.
Right, for sure. Is he doing okay now?
He's doing great. He's running and playing sports.
Incredible.
And he's a changed man. Like,
is he? Yeah,
I mean,
6 inches is incredible. I mean, that's a lot of height.
It's just one that I'm thinking of. But I've had a few of them that have been able to gain the full 16 centimeters. But it's not easy. It's not easy, but it does change their lives incredibly. But even 3 inches can make a huge difference.
Of course,
for someone that's really short.
Absolutely. All right. The next question here is from Janu. He is asking. Actually, let me just see. Randy is okay. Let's see. Here it is, right here. Question, Dr. M. Thoughts on a ratchet nail that's used in Europe and the FitBone? Why aren't these as established as the Precice nail? He's shaking his head.
Yeah. So the ratchet nails. First of all, they're a lot of times they're very unpredictable. Because as you twist and turn and walk, the thing can start lengthening on its own. Mm-hmm. Plus, you have the regenerate bone, the new bone that's forming as you lengthen. Yeah. So, you don't want to take that and twist it around and break it. I don't think you get as good of a quality of bone when you're using these ratchet nails.
Interesting.
So, that's why, and there's a reason why they've never been FDA approved in the U.S. So that says a lot in itself.
Yeah, for sure. And then he follows up with the FitBone from another company, Orthofix. There, it's a electric motor type nail that distracts that way. Have you?
Yeah, that thing, I've seen it. It looks really uncomfortable. I've never put one in, but I mean, the thing is, like, I've read about it, and I've seen the techniques, and it's like sitting right underneath your skin, where you have to keep pushing that area. And I mean, I think it would just irritate that part, and it just looks very uncomfortable. And I think there's a limit with the FitBone. Like, I don't think you could gain 8 centimeters. I think maybe 5 or 6 centimeters.
5, 6 centimeters.
I don't quite remember.
Okay.
So that's the FitBone. I know it's a good nail for correcting deformities, but I don't think it's as good for cosmetic lengthening.
Gotcha. Okay. All right. So let's see if there's any other questions in here. I know we're getting people pummeling in now because this is when we were going to do it. We have a lot of people watching now. Do you guys have any other questions for the great Dr. Mahboubian? By the way, if you want to reach out to him, you can see in the ticker below, we have his email, info@heightlengthening.com, his website, heightlengthening.com, and you can find all his contact information below in the show notes. Let me just check if any other questions in here. Most of our patients. By the way, big shout out to Amanda. I see you helping out in the chat.
Hey, Amanda.
Yes. Here we go. Actually, I think one just popped in. All right, let's see here. Oh, Amanda's answering all the questions. That's why. She's doing my job for me, for your job for us. Well, what's new, Dr. Emma? Is any other new developments over at Height Lengthening that you want to kind of talk about? This is your chance to talk to all your fans out there.
Well, we've kind of been blowing up on social media, TikTok, Instagram. I've done a bunch of interviews now. I just did another radio interview in New Zealand.
Really?
We were recently on Telemundo, which was pretty cool.
Yeah.
Even though I don't speak Spanish, but I've had patients that speak Spanish, and they interviewed one of my Spanish-speaking patients. So it's been interesting. We've done a few articles that went viral, so it's been fun.
Yeah, that's awesome.
I never expected fame from going into this kind of work, but
yeah, for sure.
There's a lot of fans, I guess, and people that really like learning about it and reading about it. So it's cool.
Absolutely. Your popularity is through the roof. And talk about your new office. I know you guys relocated recently in the last year. And, I'd love to have, one time we'll get you on where you can actually walk through and show it off. It looked amazing in some of the pictures I've seen, but talk about that a little bit. What's different?
Yeah, so it's a very brand new office. We have a state-of-the-art X-ray machine that we could, do the full length X-rays, in case there's a leg length discrepancy. We have great staff, and we're right across the hospital where I perform my surgeries. Plus, we're in a medical building, so it makes it easier for my patients who have to see their other primary doctors. They're like all in the same building, so it's pretty cool. If you ever want to come by, I'd be happy to show you around. It's a very nice office. This is my new office background, so
it looks so cool. Yeah,
clean and chic, and I have windows that I could look outside and look at my hospital right across the street, which is pretty cool.
That's awesome. Yeah, if I'm ever in the LA area, I'm gonna definitely visit. We have now a few questions just popped in, so we'll ask a couple more. How much more time do you have? Maybe 10 minutes. Good with that?
Yes.
Okay, cool. Let's roll with that. All right. So next question is from Archangel Uriel. He's asking, Dr. M, what's one of the very bad outcomes you have seen? For example, non-union, fat embolism, etc. So complications.
Well, I've seen a few bad outcomes throughout my career, but the key is knowing how to take care of these bad outcomes or complications. I've seen compartment syndrome where you bleed into the leg, and the compartment in the leg becomes so tight that it actually cuts off the circulation of your blood. Then it becomes an emergency situation. This is one of the reasons why I keep my patients at the hospital, so I could check on them right away and then there's an emergency surgery that we have to perform on those types of patients, which I've had to do. And these are things that no matter how much you control for things that can happen, complications will happen.
Yeah.
But you have to be prepared to be able to take care of them. So
Absolutely.
I think that's been one of my bad complications. I had another patient that just could not grow bone, no matter what I did. And the funny thing is, it was one side grew great, the other side hardly anything. So that one took a long time, and took a few surgeries to finally get him out to length and equal to the other side. So again, you have to know how to treat them.
Yeah.
Complications of others that I've seen, I've seen some pretty bad complications from people that have gone outside of the country. I had one guy who came in with these external frames. This was a couple of years ago. He had these external frames, and as they lengthened his legs, the frame started bending and warping.
No.
So his bone, instead of growing nice and straight, it grew like in a U shape like this. So he was wheelchair bound. He couldn't move. Luckily, like his bone hadn't consolidated yet.
Okay.
So I was able to actually remove the external frame and put on a nice sturdy frame to help correct the deformity.
Gotcha.
That was very satisfying. Got him up and walking, and he was very happy.
That's amazing.
It ended up being a great outcome.
Absolutely.
But, sorry, I go on a tangent when we talk about complications, but it wasn't my complication. It was somebody else's complication.
That's exactly what people want to hear, because if you see what Dr. One's saying here, he said, you got a crowd now. Let Dr. M tell us some notable stories. So you just did. Okay, so we have a few more questions here. Let's run it for 5 more minutes. So JC's asking, do you do limb lengthening for people with type 2 diabetes and gout?
Yeah, as long as it's well controlled. I've had plenty of patients that I've done surgery on that have had diabetes. Gout, yeah, I've had patients with gout also. Gout is a little bit more tricky than diabetes. Diabetes, it's easy because there's diabetic medications that you can take, insulin, diet control. So as long as they keep their blood glucose levels fairly normal, they tend to do very well. Gout, however, is a little bit more tricky because the medications to control gout are kind of like anti-inflammatories, because gout is an inflammatory type of process. And when you're lengthening, you cannot take anti-inflammatory medications because it prevents the bone from healing. So now, with that said, I have done surgeries on patients with gout, as long as their gout was well controlled. Gotcha. And if they did have a flare-up, I told them, you cannot take your pain medication or your gout medication. You got to just ice it down, stretch, not move as much. So we did it conservatively.
Amazing. Yeah, and that goes with an experienced surgeon. Now they're piling in the questions. All right, we're going to try to get through these guys. Should have showed up earlier. I'm just kidding. No, they are piling in. Okay, so this person's asking about, do you guys offer housing? If so, do you need to pay monthly? Or do you have just local accommodations? How does it work?
We provide like suggestions and recommendations of local places. Everybody has very, very specific specific wants of where they want to live, how much they want to spend. So it's difficult to try and accommodate everybody's needs. So I just say, listen, in LA and where my practice is, there's plenty of hotels in our area. There's Airbnbs. So we make our recommendations, but I think ultimately, as long as they find a place that has wheelchair access, that's all they need.
Yeah, for sure. Okay. Next question here. Dr. M, I read a mixed opinions about reaching 8 centimeters. Is it best to stay around 5 centimeters? I guess for the femur. That's what he's probably asking.
Well, it depends really what your goals are. And also what your flexibility is. This is one thing I always tell my patients: work on your flexibility before your surgery. Yeah. It is the key component to being able to lengthen as much as possible. The more flexibility you have, the longer you'll be able to lengthen. So I don't think you necessarily need to put a stop point at a specific number. It's
Mhm.
really what your goals are and how much you want to lengthen.
Gotcha. Awesome. All right. Next question here. We'll go for a couple more minutes. Regarding humerus lengthening, does it heal faster than our legs? Also, how much lengthening would you advise for these bones? I guess the arms. He's talking about arm lengthening.
Right. So the humerus, which is your arm bone up here, is very similar to your femur. It's one bone. It's very vascularized, so it does grow good bone. You just have to lengthen it at the appropriate rate. But it heals about the same as your legs, and we usually go by anywhere from 0.75 millimeters to a millimeter a day of lengthening. As far as how much I would recommend, I usually for the arms I would not recommend anywhere more than 5 centimeters. That's like the max. Now I know a lot of people think, oh, I've lengthened my legs so much, I need to be proportional and lengthen my arms. I really disagree with that. I don't think you necessarily need to lengthen your arms, because you're not changing the length of your torso as you do the limb lengthening procedure. You're lengthening your legs. Your legs look longer, but it's not going to make your arms look any shorter. Right. Because again, when you stand up, your arms are at your side of your hips or your thigh. That length does not change because you're not changing your torso. Absolutely. I think people look more disproportionate when they lengthen their arms for cosmetic purposes. So again, I don't think it's necessary. If you feel that you have to do it, no problem. But I really don't think it's necessary.
I'm with you that. I get a lot of requests to make videos about arm lengthening, and I'm like, this is a leg lengthening channel. I don't think it's really that necessary. So, all right.
Good question though.
Another little joke about Dr. One saying, not enough degrees behind your wall, Dr. M. That's funny. All right. So Thomas Powell saying,
you haven't seen the rest. You guys can't see the other ones. But.
They're on the front side. He's going to flip the camera. Thomas Powell is asking, Dr. M, I'm wondering if I should stop building muscle in my legs in preparation for the surgery, as I've heard it makes you less flexible.
This is true. If you have bulky muscles, such as someone who's do I point this way to you?
Yeah.
Someone who's a bodybuilder, yes, it makes the lengthening process a lot more difficult. Stop showing off your guns. So I wouldn't recommend building more muscle. If anything, I try to tell my patients to try to thin out a little bit, but more like, trying to lose fat than the muscle, because you will lose muscle regardless after you undergo the lengthening process, because you're not putting your full weight on your legs. You're not able to exercise as much. So you will lose muscle. But again, you don't need to bulk up for it either. Because again, if the more muscle mass you have to stretch out all those muscle fibers. So it makes the whole process a lot more difficult. So again, try to focus just more on being limber and flexible.
Gotcha. Okay. All right, guys, we're going to take 3 more questions and we're going to let Dr. M go because it's been, let's see here. So next question from Janu. Let me find that. Here we go. He's asking, are there any tests to determine if a patient will have sufficient bone growth prior to the surgery?
There's a bone density test that you could do, but it really doesn't determine how much bone you're going to grow. So the answer to that question is really, we don't know. We don't have an actual test to see how much bone you're going to grow. But as long as you are healthy, you have a proper diet, you take your supplements during the lengthening process, and you're walking around and stimulating the bone to grow, there should be no reason why your bone won't grow. It's just like, if I break a bone, how am I going to know if it's going to heal? Because it's the same healing process that we're using to lengthen out the bone. Because as the bone tries to heal, we're separating the ends of the bone, so new bone keeps forming. So unless you're, you have osteoporosis, which is usually what we see in much older women who are postmenopausal, then and all we would need is a bone density test. But again, I wouldn't recommend it for someone that has osteoporosis. So that would be the only thing. Otherwise, there should be no reason why you don't develop good bone. Oh, maybe the reason why he's asking that question is because of that one complication I had.
Yeah, that's right.
of one patient. But again, that guy, he grew great on one side and then not so great on the other side. Now, this was before also when I had changed around my techniques of how to cut the bone. Because again, you got to make sure you cut the bone with the least amount of trauma. In the past, I used to use a saw. It's called a jiggly saw.
Jiggly saw, yeah.
Where we wrap the bone with go around the bone with a thin wire, and we go back and forth with that wire, and that wire cuts through the bone. The problem with that jiggly saw is that it doesn't just cut the bone, it also cuts the circulation around the bone, which is really, really important for bone growth. So I think that was one of the reasons why he didn't make very good bone. But again, with the new techniques that I use, I've had no issues of growing new bone.
Awesome. That is reassuring to hear. All right. Last two questions here. This one right here. JC's asking, have any of your patients had side effects or have had a side effect of a total knee replacement due to a skewed femur or tibia ratio?
Not that I've seen. I understand, people talk about, when you're changing your proportions, it can throw off the degrees of your legs, but it's fairly minimal. Also, it can make your joints kind of tight. We still have yet to see studies to see if that really happens. So far, the studies that are out there, we haven't seen an increased amount of osteoarthritis in the knees or in the hips after undergoing limb lengthening procedures. And part of the reason is that once you regain your flexibility with proper therapy and you regain your motion, the pressures inside the knee really drop. It just makes sense, right? Because you don't have the tight muscles anymore and the tight ligaments. So, I think that tightness in the knees or in the hips or even in the ankles are temporary. And as you recover and as you become more active and more flexible, those risks kind of tend to vanish.
Interesting. Wow. Yeah. Okay. So it's something temporary. Okay, guys. Last question here from Archangel Uriel. He's asking questions to close the live. Yes, this is the last question. Is Dr. M happy with making patients happy, reaching their goals, and what keeps them going in their field? What keeps you going, Dr. M?
I tell you that every single one of my patients that I've done the height lengthening procedure on, it's really impacted their life.
Wow.
So when they're done with their lengthening and, we sit down and we chat. So how's life? How things changed? And everything that they talk about is that it's been positive. So it's really reassuring to me to see that, to see people's lives change for the better, and that's what really keeps me going and makes me really happy to see my patients doing well. I've had plenty of stories where, guys who are shorter than average, and after going through the procedure, they say, now people actually pay attention to me. They don't treat me like a child. They don't make fun of me anymore. And they just have so much more confidence. So it's really amazing to see that transformation.
Man, that is super, super inspirational just to hear that. A surgeon that loves his passion, his craft, and is amazingly, talented at it. I mean, this guy is one of the most experienced surgeons in the world. So if you guys want to reach out to the great Dr. M, you can find all his contact information below heightlengthening.com or info@heightlengthening.com to email him or Amanda. And if you guys want to reach out to him, you can do that there. And Dr. M, I want to thank you for coming on to do this live Q&A. We're definitely going to have you back. You always have a home here on Cyborg for Life. So you let me know when you want to come back. And that's all I have to say. So guys,
thanks, Victor.
I appreciate everybody coming on. And until next time, this is Victor from Cyborg for Life and the great Dr. Mahboubian signing out. See you guys next time. Bye.
Bye-bye. Thank you.